Good evening, everyone, and welcome to our Fertility Live Q&A. We are going to be going live tonight with Dr. Kenneth Gelman of IVFMD. And as always, we're here to answer any of your questions that you may have regarding treatment there. I see Dr. Gelman popping in. Actually, I don't see it under IVFMD, so we'll wait for him to switch to the IVFMD one. Let me see here so that everybody can join. So my name is Farah Duro. I am a licensed acupuncture physician and I specialize in reproductive health. We work with women of all ages and couples as well. Sometimes we actually have several generations of families coming in together. We specialize in PCOS, endometriosis, female infertility, secondary infertility as well. And we do have treatments that span across the spectrum from just, acupuncture to working with herbal treatment as well. And in conjunction with myofascial release and lymphatic drainage, we have a wonderful massage therapist as well. And we're located in Hialeah Gardens. So we will wait for Dr. Gelman to request to join us from the IVFMD account so that we can make sure that we get him in. But in the meantime, I want to encourage you guys to please type in your questions. You can go ahead and type them in the comment section, or you can also, if you don't want everyone to see, you can actually put it in the question box too. And by hitting the question mark on the end. And also, if you'd like to share this with a friend, you can definitely do that now. You can hit the share button and you can let them know that there is help available. Both Dr. Gelman and I have been working with patients who are struggling with fertility issues for decades. So we hope to share our knowledge with you. Hopefully something clicks that we say and that will be helpful, that you'll find helpful. He has lots of pearls of wisdom to share every time we do this. I always look forward to it and I learn something new. So we are going to have him on soon. But I wanted to share a little bit of something we're doing new at the office. We're actually using a technique with our massage therapist that some of you guys might have heard of. It's called MLD. It's actually a manual lymphatic drainage technique, and it's pretty cool. I just wanted to talk about it because I feel like we talk a lot about acupuncture and we talk about that sort of thing because a lot of focus is always with fertility on acupuncture. But for those of you who are a little needle shy or wondering if there's any other alternatives to using acupuncture, you can use this in conjunction with acupuncture, but also you can use this in lieu of acupuncture sometimes in between your cycles where maybe it's pre-ovulatory or you're trying to kind of help with any kind of bloating, PMS, cyst that might be popping up a lot. So that's actually something that we've implemented in our office, and it's called, some people say just lymphatic drainage, but there's actually specific techniques we use to help with kind of increasing circulation and detoxifying a little bit through that the lower abdomen, and using those special acupuncture points with acupressure instead of needles. So that is with our amazing massage therapist, Carol. And sometimes what we'll do is actually plan to do that session prior to acupuncture. So I am still waiting for Dr. Gelman to join. He might be having problems logging in, but maybe if Shirley's watching, she can help him log in a little bit so we can go ahead and get started. Let me go ahead and see if there's any other request. I'm actually going to try to send an invite right now. So let's see if we get a response there. And there he is. Awesome. Okay. Like, where'd he go?
It keeps switching accounts on me. I don't know why.
That's okay. Well, we got it figured out. That's fine.
Yeah.
How are you?
I'm good. How are you?
Good. We had a lot of questions pop up, and we'll wait for everybody to kind of join a little bit. I know that this is the first live I've done all month, I think. So I was on vacation, and
And who
Wow.
knows if you were traveling. But now I'm back refreshed, and I'm looking forward to it because there's a lot of good questions that have been submitted beforehand. But also, if you guys would like to go ahead and submit your questions, like I said, we'll definitely try to get to those. We are here to support you, to help you through this. A lot of times the fertility journey can be very stressful. It's hard to get all the information in one visit, especially if you don't see your doctor for a few months and you're kind of like nervous about what to ask, and then you forget to ask certain questions. So we are here for you, and we are trying to do this on a monthly basis as well. So please go ahead and introduce yourself also, Dr. Gelman, to people that don't know you.
I'm Kenneth Gelman, one of the doctors from IVFMD. One of the, is it 11 now? I can't remember how many we have.
A lot.
I think it's 11. From one of the offices. We're in Cooper City with Dr. Wood and Dr. Gerkowitz, and it's always great to be here. And this is a lot of fun for us, and we really enjoy this.
Yeah, it's so much fun. And we've
It
both been
is.
doing this a long time, but I always learn something new from people that are actually asking these questions, because things always change, as you know, and evolve. So
Yeah.
so that's great. So we'll jump in then. So the first question that we have is actually about acupuncture. How safe and how often acupuncture after frozen transfer twice weekly is too much, with a question mark. So I could talk about that. I mean, we definitely
Yeah.
recommend twice a week still with our patients, because a lot of stress and nerve-wracking days are actually happening between the transfer and the pregnancy test. And they're a little bit like, I mean, actually, if we are present during the transfer, we see our patients back like 5 days after, because we want everyone just to rest and stay home and relax a little bit. But then we do see them afterwards. And usually it's kind of a nice thing to kind of have that treatment in, if they're able to do that. We also still focus on circulation, sympathetic nervous system response, relaxation. And then we also treat up until the end of the first trimester, since we're kind of working in some of those pre-anti-nausea points, and very gently working with points that are acceptable and safe during during the first trimester as well. So what do you normally tell your patients, or do you give any advice on that?
Well, it's exactly right. I mean, I think I tell them as early as possible. I mean, the earlier the better. And the real studies, I think, are 6 months before they even, go through infertility treatments. But, most people can't do that. I mean, some people are, getting into treatment pretty quick. And, so a minimum of twice a week is ideal. But, 3 times would be better, I think. But, people have schedules, they have things to do. I think twice a week is probably a very good, compromise for that.
Yeah.
But,
And afterwards, they are concerned sometimes. Is this really going to be safe? Like, should I do acupuncture? It's actually one of the safer things to do during pregnancy. I mean,
yeah,
there are lots of patients we have that are referred from OBGYNs for low back pain, for instance, or during pregnancy, or nausea, vomiting, that sort of thing. So rather than take Tylenol or take things over the counter, you want to try to, if it's a trigger point causing back pain, it's kind of like the analogy of, like, there's a little pebble in your shoe and you keep walking and someone's offering you, here's a painkiller, but you keep walking, you still have pain. Why do you have pain? Let's take the pebble out of the shoe, which is usually that trigger point that's causing the migraines or pain and all that. And that you can safely work with during pregnancy with
right.
acupuncture, which is really nice. And then if you do go to someone, just ask them, do you guys work with pregnant women? And how often do you see pregnant women? It's really important. And also with massage too, you want to make sure they're trained in prenatal.
Yeah, I think
Yes,
I think
massage.
the important thing, I think the thing I like, that you stress a lot is that you come to the transfer with the patient a lot, and I think that's a key thing, because I'm very attuned to the fact that the uterus has to be quiet,
Mhm.
or as quiet, as motionless as possible while we're transferring the embryo and after. You don't want the uterus contracts and things. That's why you're on progesterone, and so I think that day, I think, is extremely important. As a matter of fact, we should probably do a study
Mhm.
on how many people get pregnant, on the day of acupuncture of the transfer versus not. I think that would be an important study.
That would be awesome. Yeah. And we do have our own statistics, like we keep up with our own data, but that's just from our, patients that we
Yeah.
see. So we don't know
It would
the
be
other.
interesting to see that the day that you were actually there, or your partner,
Mhm.
somebody's doing acupuncture on them, how many of them really got pregnant? I think that might be something interesting
It's
to
a
look at.
good question to ask too, if before the transfer, maybe have you had acupuncture?
Yeah,
I know there's lots of variables, but yeah, I mean, it's great. We love to be there when we can, and
yeah,
if it's a possibility.
yeah,
But you guys are awesome that you offer that for your patients.
yeah.
You allow
No, it's
that.
great. It's great.
So yes. How about can you have a high testosterone level without PCOS that impacts egg quality?
Well, high testosterone, I mean, there's obviously other causes of high testosterone in a woman. Most commonly is PCO, but there are other things you'd have to think about. One would be, God forbid, a tumor, something in the ovary that could be making, male hormone abnormally, hyalus cell tumors or androgen secreting tumors, or sometimes in the adrenal gland, but more commonly in the ovary for testosterone itself. That would be a rare cause, but the majority of high testosterone is usually PCO, and then occasionally something called congenital adrenal hyperplasia, where male hormone excess occurs, not so much testosterone, DHEAS specifically, and those hormones could act or look like somebody has high testosterone because you get some virilization or androgen type symptoms, facial hair, acne, irregular periods too, and it's not PCO, or it can be associated with PCO, but it's actually a adrenal problem, and usually congenitally inherited too. So there's other causes of male hormone excess, let's say, not necessarily high testosterone, but high testosterone, and if it's very high, you always got to think of tumors such as the over 200 in a female.
So if it's
But
kind of
but
like
in
borderline,
PCO, you could see very high values up to about 150 or so.
okay, that could affect egg quality, the
Well,
testosterone.
it's going to affect ovulation. If somebody's got really high testosterone, typically that's probably one of the reasons they're not ovulating. I mean, it's
Hmm.
interfering with the whole ovulatory process, which is a very delicate balance between the pituitary hormones and the ovarian cells that make estrogen and feed back on the pituitary gland, and testosterone is going to interfere with all that. So that's one of the reasons, obviously, that women with PCO don't ovulate. So egg quality is not really probably affected. Maybe it's more like ovulation or the ability to ovulate and get pregnant, period.
Okay. And then we do have a question that popped up on the chat here. What test should I ask about before FET if I only have one embryo?
Yeah, that's a good question. I mean, that is going to be controversial because it depends on who your doctor is, and what they believe in and what they think is important. I mean, in our practice, and if you only have one embryo and that's all you're going to ever have, obviously you want to make sure when you implant that you've done your due diligence, and your doctor's done his due diligence to make sure everything possibly that could cause implantation failure is eliminated.
Mhm.
I mean, so really when you look at implanting an embryo, it's really three things. There's either a uterine problem, there's a big fibroid in your uterus, a polyp, or your endometrium is not properly prepared with hormones. Um, there's a blood problem, your thyroid is completely off. You have an immunologic issue, something like that. Or there's an embryo problem where the embryo isn't chromosomally normal. And, where we have PGT, that's 95 to 98%. I mean, that's the best we have. So it's not 100%, but assuming that embryo is normal, you got to make sure your endometrium is properly prepared. And obviously, your lining has to be thick enough and, look appropriate enough during the FET preps. You may want to consider an ERA test. if your doctor believes in that, some doctors don't. An endometrial biopsy, make sure you don't have any endometritis. Some people do an endometrial scratch, or they call that a scratch, to try to help implantation. There's, also immunologic tests where you look at natural killer cell function, etc., phospholipid antibodies, ahead of time. I mean, a lot of doctors may not do these things proactively. So you want to discuss that with your doctor. Doctor, listen, I have one embryo. What can I do to help this thing implant? You want to be proactive, I think.
Definitely, yeah.
And not reactive. And, because the ERA test actually was designed for people who failed. But in this situation, if your doctor believes in it, it might be a good thing to do proactively. So I would look at those things. And again, make sure, that you feel comfortable that all the tests are done before you set up anything. Make sure your weight is good, your BMI, your health, all those factors. Stress reduction, acupuncture, that should all be done ahead of time. So it's a lot of things. A lot of things go into this, and it gets a little more complicated than just setting up a frozen embryo transfer and, transferring the embryo like we've done for many years. I mean, you still probably have about a 60% chance it's going to work, but you want to try to improve that as much as you can and, give yourself the best odds.
Yeah, there's definitely more things that have come along in the last few years, I think. I believe the success rates have been going up, right, with the transfer rates, I guess, success rate wise.
Well, yeah, I think because we're doing more, I guess we're getting better at, embryo, selecting the proper embryos morphologically, culture systems, things like that. I mean, PGT, probably helps people more that are, 38 and older. So maybe that in that group, obviously, pregnancy rates may be getting a little bit better because we're selecting the more normal embryos, which theoretically should implant at a higher rate. And also maybe acupuncture is playing a role here, maybe, immunologic therapies and things like that. But it's probably also a lot to do with the embryology team, and selecting morphologically the best embryos as well as, new culture mediums, things like that are always being developed and new ways to culture these embryos.
That's why we do this, because, I was looking at a website that mentioned embryo glue that was from Europe, and I'm like, wow, they still use that?
They still do.
Okay, yeah. Like I haven't heard that in so long. Like it's been years. I'm like, wow, I guess, different countries have different things that they use, and so it is an art form. It really is, I think so.
Oh yeah, yeah.
So we have another FET question. Between FET, how long or how often should I do acupuncture? Doing it once a week right now while waiting to set my FET date, also the day of. So we just spoke about that, really about we like to optimize as much as we can the month prior, the 6 weeks prior to, where we do ask our patients to come twice a week if possible, because a lot's going on. You're also prepping your uterus, your lining for implantation by starting all these medications and estrogen and all those things. So we try to work with blood flow the most. At that point, we do electro acupuncture, a lot of that. So it's a little bit different form of acupuncture, but it just is kind of, the needles are actually hooked up to a device. It's a microcurrent device that's actually having like a slight frequency that actually vibrates the needles a little bit and also creates a little bit more blood flow. They've actually measured this with Doppler, and they saw greater blood flow in the uterine arteries when electroacupuncture was used. So we want to optimize that time of your cycle to do as much as we can on our end, and then also help your medications work better if we can do that. Because the lining thickness is always a stressor with some patients. Like, is it thick enough? Is it too? They're like, is it just right? So, and then also the day of, we do acupuncture on site. We try to do that. There's a protocol that is not our protocol. It's actually based on research done many years ago in Germany, where they actually did one treatment prior to the transfer immediately and one treatment immediately after the transfer. And then they measured the success rates, and they had about a 35% increase in take-home pregnancy rates, which are pretty good.
Pretty
So they
good.
duplicated that study a few more times and with larger scale studies. So they noticed that that has been helpful. And the purpose of those points are actually twofold. And the first treatment set is actually to help relax the cervix. So, and also with, obviously to help relax you, because people are a little bit anxious during the transfer. A lot of times they're like, is this going to work? The partner might be a little stressed. So we try to do our part in helping with that. And a lot of times we notice that the doctors have mentioned that, oh, the cervix actually is a little more relaxed. It's easier for me to get the catheter in when the patient's nice and relaxed after the treatment. So that's our goal with that. And then the second treatment is done immediately after your transfer. And also those points, the intention is to prevent uterine contractions. So that's really what those do. And that's it. And then we, you're on your way home to hopefully just relax and watch funny movies and chill out.
Right.
So that's it.
Which somebody just asked about there. I see walking or resting after a transfer.
Mm-hmm.
And I'm old fashioned with this. I send people right home for 3 days of bed rest. I still think that that's the advisable thing. Some people actually stay longer.
Yeah.
And again, I tell people, you're spending all this time and effort, financial, emotional, in investing in this thing that we all want for you badly. Make it work. I mean, why not go and rest and take that time off and plan that time, because you have that frozen embryo transfer planned. It's not like we sprung this on you and said, okay, you're getting a transfer tomorrow. You know when that transfer is, and you have a date, and no doubt you took that day off of work. Why not take 2 or 3 extra days? So I would absolutely suggest resting.
Yeah, and how often do you get to do that?
And that's the other thing,
It's
and
nice.
husbands have to cooperate.
Yeah, you need some help with that. And if you have toddlers at home, definitely you need help. You just, having people lift the babies or, try
Some
to
people
help
go to a
out.
hotel for 3 days. I mean, that's
Mm-hmm.
a good idea.
Yeah, stair climbing, you guys don't recommend that, so,
No,
right.
I would not do that.
Yeah. So you have to kind of camp out downstairs if you have your bedroom upstairs, but it's just, it's an experience. There you go for 2 days, right?
No,
And
it's great.
then, and as far as the laughter goes, there has been studies about that. I mean, I really like those. Those are my favorite studies, actually. That they had one in Israel where they had a clown come to the treatment room. I don't know, the transfer room, and
I didn't see that.
they actually measured cortisol levels. This was really cool. This was many years ago, but they had a clown come and actually just perform things where people actually had really deep belly laughs after the transfer, and they noticed that they had higher implantation rates, the ones that actually laughed the hardest. I think that's pretty cool. So I guess the cortisol levels looked pretty good. That's what they were checking. But whoever thought of that study, that's awesome. I applaud you. It's very creative. Maybe we should just come dressed in clown suits. That's what
Yeah,
I'm
right.
thinking. That'd be great.
Well, we're kind of in our pajamas most of the time anyway.
It's kind of like Patch Adams. If you ever been to see that Patch Adams movie, that's kind of like that.
Yeah.
So it's okay to laugh and to have fun. And people have asked, like, is that going to hurt the embryo? Like if I laugh too much or if I strain?
During the time of the transfer, I wouldn't necessarily
Well,
do
no,
it. I
definitely
mean,
not.
after, because
After,
we
yes.
actually encourage no joking around actually during the transfer.
Yeah, serious business there, yes.
It's serious business there. I mean, after that, maybe it's a different story, but after 48 hours, when the embryo implants, yeah.
Yeah, so I'm going to try to find that study again. Let's see if I can post that. It was awesome. Okay, so we have a question about PCOS. If you have PCOS and you don't know if you ovulate or not, how do you know when you should, how do you know when you should do the transfer if you possibly don't ovulate?
The transfer. Well, if you have PCOS and you're going through IVF, that's all sort of programmed by the doctors and the nurses. I mean, all that'll be taken care of for you. You don't have to worry about any of that. Because what we do is we sort of take your own cycles out of the equation and we create our own basically in you. We make you create those eggs that you don't do on your own. We make them grow with fertility drugs. And then we shut your cycle off, and then we just prepare your uterus once we have embryos and transfer those embryos in. So we do all that for you. You don't have to worry about, your PCOS and your own cycle getting in the way. It will not.
Yes, they're totally manipulated for a reason.
Correct.
Yeah. And okay, so I'm going to go back to some of the questions that were submitted earlier. Is there a certain brand of prenatals that you recommend over another?
No, I mean, I think there's so many of them out there, and a lot of times we may recommend one brand because sometimes the rep comes in, leaves you a lot of samples, and they give you a good bill of sale, and they tell you this one's got this more active folate in it, and this one has more iron, and this one has a stool softener and all that. And then you try to prescribe it to the patient, and unless they give you a copay card, it's unaffordable. I had one patient tell me it was $400 for a prenatal vitamin. $400 for a prenatal vitamin. It's
Holy
insane.
moly.
And
Sheesh.
that's with a copay card, maybe it was 25 or something like that.
Mm.
And then the insurance may not approve it. So your problem is going to be what your insurance improves, and what your copay is going to be, and all that. So that sort of will determine a lot of times what prenatal you're getting. Obviously, if you have the proper ingredients, to classify itself as a prenatal, and it's a drug company made prenatal, it's going to be a good one. So sometimes we may give you, a little extra iron, or we may give you an extra, stool softener with it, things like that. Or some people require more active folic acid because they may have an elevated homocysteine level. So we want to lower the homocysteine with more active, what's called quatrefolate, to lower that level down so we don't have any clotting issues. But other than that, whatever we have samples wise and whatever your insurance is going to cover is usually that's usually what people end up getting.
So I just looked up really
And
quick.
then the other thing is what agrees with you, because sometimes certain ones don't agree with you, other ones do. Some people get really nauseous from them, and sometimes we got to use one that are higher in B vitamins so you don't get nauseated. So there's a
No.
lot of variables with those.
We just made sure they recommend like that they look for the methylated folate because a lot of those food-based prenatals or over-the-counter prenatals, they don't have that type of folate. So if whatever they're taking, it's good to check and make sure, right, that
Yeah.
it's methylated. So
Yeah.
it's a type of folate everybody can absorb since it's a really
Yes.
common
Exactly.
thing to have. So really quick about the clown study, I just looked it up. It was published in Fertility and Sterility. So I will be putting this link on my Instagram, but it was 219 women actually undergoing IVF. And they had a medical clown actually can't come in right after the embryos were transferred. And they had a higher pregnancy rate. So I'll link to this, guys. I think it's fun.
Yeah.
So the other questions are that we get a lot are we do have some fertility questions about on vitamins, and I think that in that sort of space, someone asked, is there any vitamins for men to take to boost their sperm count? And I don't know. We've seen a few that actually, you can answer that question better because you're the one, looking at those samples. But a few patients have come back after taking certain supplements, and they've related to us that they did have better quality of the sperm
Yeah.
count. So.
Yeah. I mean, I think there are certain vitamins. I mean, there's certain male fertility blends. There's a couple of them we have in our office. I like the Coast Science one. And that's been, we did a little study many years ago with, I think, Dr. Brown, who works with Unilab. And they looked at, certain parameters on sperm function. And, we looked at a lot of the guys, some of the soldiers coming back from Iraq, because some of these fellows have really poor sperm function when they come back, motility wise and things, particularly, probably because of the heat and the exposures and who knows what over there.
Mm-hmm.
And when they come back, we put them on these vitamins, and in 6 weeks, we see improvements in their motility, particularly. Sometimes counts, and things do improve. Sometimes you see a dramatic increase with just vitamins. Actually, I remember one guy, a dramatic increase. And that's all he was doing. But also we take them out of that environment. We put them, we take them, make them wear boxer shorts. We, take their laptops off their laps, make some obviously changes in their lifestyles That probably helps too.
Hmm.
And, certain times, we may have to resort to other therapies. We may have to add a little clomiphene to the men, which we do off label, and that may help boost some of these guys. And, or we send them to urology. But maybe some of these guys have varicoceles and things like that that need to be looked at. So, it's a combination of many things. It's not just vitamins, but I think it's a good idea that men take vitamins, fertility blend. And these are not multivitamins. These are fertility specific, high in carnitine and certain things that may help improve the tail motility, so to speak, and high in antioxidants to keep reactive oxygen species from sort of attacking the sperm, which is the idea behind, lowering your exposure to heat and radiation, obviously, and, avoiding toxins, drinking, smoking, if you're working with chemicals, inhaling things, so there's a lot of things we can work on with the men too that may have, some effects, sometimes dramatic.
Yeah, so they're asking, I guess, for the
Co-science is the one I typically use.
yeah, there's some companies that actually have the ingredients listed, obviously, and some of the research that is behind those supplements. So, so definitely, I'm trying to think of we actually have used a few as well, and I think they have similar ingredients like L-carnitine and CoQ10 and vitamin C.
They're very high in antioxidants. Yeah.
Oh goodness. Okay. Sorry, I have an iPod issue. We're backwards. Okay. So we have.
Let me see a question also about will you post the brands or the names? Like maybe we can do a little post about that. We can follow up with it. Just maybe with Marta, because I think Marta's doing a Q&A tomorrow or Wednesday or Friday. Maybe it's tomorrow. But check with. I think that would be a good question for Marta because she's very big
Yeah.
on. She does a lot of the supplements and works with a
Yeah.
lot of the men too. I know.
That'd be great.
Okay, so for a girl that's 30, how long should I try before I start thinking about IVF?
That's a good question. I mean, well, typically somebody like you probably should be trying for a year. I mean, but people come in, a lot sooner because they're nervous, they're anxious. This is a very emotional field, and people are very anxious, and their friends are getting pregnant, and their mothers are looking at them cross-eyed. Why aren't you pregnant? That's a hard question to answer. I mean, but typically people go in for infertility therapy after that age, after a year of trying, and they get worked up, they get evaluated, and even if it's before a year, there's no harm in, getting a workup, just going to the doctor, even your gynecologist, say, listen, I'm trying for a few months, I'm nervous. Can you just do a workup? Get an AMH, get an HSG, maybe your husband gets a sperm count, and, some basic things that might, make you a little more relaxed. So you can keep trying and, make sure when you're ovulating. I think that would be a good start too. Some of those ovulation kits are pretty good. So, if you have a regular cycle, I would use that. But there's no harm in going to a doctor before a year. I think most doctors with a 30-year-old will probably do exactly what I said, that they probably work you up and evaluate you, maybe monitor you for ovulation or something and help you trigger your ovulation and send you home for intercourse or something like that. And obviously if your cycle's not regular, you may want to come in and get that evaluated, and maybe you do need a little help with some fertility medication. But unless there's some reason that you need IVF, like your tubes are a problem, or your husband has a very, very low sperm count and it really can't be fixed, or he has absent sperm or something, then maybe IVF is going to be done a lot sooner. But most often we don't do IVF that often in women that are 30 right away, unless somebody absolutely wants it. I mean, this is an elective field. We can do IVF tomorrow on anybody who might want it, but that's typically not the case. We would, probably elect to counsel that person and tell them maybe you should try this first and try simpler things.
No, and
But
that preconception care is also helpful. I mean, just to kind of get everything hopefully like optimized. Maybe your vitamin D level's a little low. Maybe your thyroid needs to be, optimized a little more. So yeah, just like you said, going in and just getting maybe just a regular workup, that could be helpful. And it's 20%. The odds are 20% a month, I think, for someone at 30 years old to get pregnant. So sometimes it takes a few months, but yeah, after a year or
well,
so,
they say about 85% within a year
Mhm.
should be pregnant. So give it a try for a while. I mean, I wouldn't panic at that age. But,
Yeah.
if there's other things that are not normal, like your cycle or, something like that, I would get in there and get evaluated sooner, or you can't track your ovulation, or, if your husband is, smokes heavily or things like that, you may want to get him tested, there's things maybe in your history you want to talk to your gynecologist about. I think it can't hurt to talk to your doctor.
Somebody just said, don't wait, go see Dr. Gelman tomorrow. There you go.
Sure. Be happy to see you.
Yes.
I mean,
Yeah, definitely. So, and as far as that goes, you guys are still, hey, it seems like we're back in, mask and all those things with COVID. And even if you're
yeah.
vaccinated, that was something that was announced today. So in Miami anyway. So you guys still do virtual visits, right? For, the
Yeah, as a matter of
consultations
fact,
and
I was just thinking before we got on here, I guess because we've been doing this thing regularly for several, for months now.
yeah.
I guess, I just, we've been seeing people from all over the country.
Yeah.
It's great. I love it. I mean, I've been seeing a lot from North Florida, a lot from like the Tennessee area and
hmm
all over, really.
Very cool.
Somebody, where were they? Somebody in other countries too.
hmm
I mean, it's just more of, more people are just, using technology and now, and, it's just nice to connect with people and, and we really can do a lot this way.
Yeah.
It really, in the beginning you think, well, how much can we really, but we really can, because, you can really connect with somebody, get a history, and everybody lives near, some facilities.
hmm
So we can just, send the people to specific practices in the city where they live, and, they remote us the data right away that day. And it's great because you could just help them that way. And we do it all the time. So it's so
Yeah.
easy now
hmm
with this kind of technology. This is the best part of technology, no question.
Someone says, how do you feel about the title Transfer King?
Who
Transfer, like
wrote
Viking?
that?
Myri.
Who wrote
Well,
that? That's got to be one of my patients, because that's so funny.
oh, guys, you're making him blush, all right? No.
That is funny. Who
Well,
is that?
Myri,
I
we
don't
all know
know.
your name. Okay,
That's
but
funny.
that's a compliment, I'd say, definitely. So, I
Yeah.
remember I saw one of your patients from Central America too. I mean, they were living there and they were coming here for treatment, doing acupuncture when they came into town. So there's definitely ways to, to work with that distally as well. Okay, so wow, we still have some questions.
There's a
Let
good.
me,
There's a
yeah,
COVID question there.
there. Okay, so well, let's go ahead and talk about that one, and then we'll jump back into our previous questions here. So, okay, had COVID in March, haven't gotten the vaccine, planning on doing my transfer hopefully in September. What do you feel about getting the vaccine, and if so, when?
Oh, that's a good question. I think that question I don't think has really been answered by anybody, and I don't think anybody really has the answer about what to do about that. I think I probably would get some sort of antibody test to see how high your antibodies are. I would assume you could get that test at Quest now, or through your doctor, because it doesn't seem like you're going to get the vaccine. But maybe if you have low antibodies, you might want to get the vaccine. But I wouldn't do it I would do it a minimum of 4 to 6 weeks before you transfer.
So time's ticking because the transfer is September.
Yeah,
So
yeah. So you really gotta like do it soon, and because there's some theories that this is a controlled inflammation that it causes, and you don't want to necessarily have that going on when you're transferring an embryo in there. Although obviously nobody's really looked at that yet, for sure. But it's safe to get in pregnancy, so I would definitely think about getting it, sooner rather than later. Maybe you get your first dose, and then get your second dose once you're pregnant, kind of thing. Because you get a pretty good bump in your antibodies from the first dose, apparently.
yeah, definitely.
But whether you're getting the vaccine, I guess you are going to get it. So maybe check your antibodies too, and make sure you got antibodies. And maybe your doctor's going to tell you not to, because you're already immune.
Yes, and that question has been evolving. It really is. So we'll just
that's going to change. Our advice is going to change.
Yeah. So
just like the mask thing is changing and changing.
Yeah.
But apparently, what they're thinking, I think, is that once you're vaccinated, you could be harboring fairly high levels of virus and not be sick or not know it, and be walking around and spreading it. To a lot of people who aren't getting vaccinated, and that's the reason, I guess. Which I guess is a good reason to tell people to wear masks. I think it's the right thing to do because of this variant thing. Even though it's obviously a pain. It's annoying as hell, and nobody wants to do it. But look, it's almost to the point where a lot of us are getting used to it. It's almost like part of your dress.
Now, a year and a half, I guess it's been. So it'll probably be another year, probably.
Oh, I think so. I think so. It could be longer, because if people, don't get vaccinated, then you have, and there's not enough herd immunity out there. This virus is just going to keep spreading and mutating, and keeps mutating. How are you going to get rid of it?
Eventually, yes, it'll be endemic, I guess, and people will all catch it at some point. So, but yeah, it's eye-opening. We have a patient who works she's a respiratory therapist in the COVID unit in Jackson, and she tells us like it is, it's pretty much, you don't want this, and you don't want to be in that situation.
No, it's bad. It's and the hospitals are filling up again. The ICUs are filling up again. And, there may be more shutdowns coming. I'm afraid of that. I'm really afraid of that, and I really don't want to see that. And nobody does for the economy, and I think it's really important people get vaccinated. It really is.
Yes, and so we have. Let me go back to a few of these questions here because I have one in Spanish. I'll try to say it here. La ovodonación es efectiva para una mujer de 36 años. So asking. Yeah, is egg donation effective for someone who's 36 years old?
Egg donation?
I guess if they want to, I'm not sure if they want to be a donor or they're thinking about having a donor. At what age do you say, okay, this is a little bit like, you shouldn't donate eggs or something? Like, is there a cutoff as far? Maybe that's what the question is referring to. I don't have any more information about that, but.
Well, it depends on the patient. 36 might be a little bit old. For it to be a donor. So we would take people younger. So usually 30, 32, I think is usually. But occasionally we've had, people who are like a sister, or a young cousin or somebody who's going to be an egg donor for somebody. So that might be a good donor. Certainly the younger the better. So that person will have to be assessed, by the physician and the practice and see if they are a good donor, what their AMH is and what their antral follicle counts are and how healthy they are. so it depends on what that person's looking to do.
Yeah, yeah. So if the egg donor, you guys have a program in-house, right? So they could ask about that, I guess, and if they want more
Yeah.
information. And
Yeah, well, they haven't, I don't think they've done much with in-house donors because of COVID now.
hmm
I know they did, but I don't know if they've restarted that yet or
Oh,
not.
okay. hmm
So, that's not, I don't know the answer to that actually. I don't think
Okay.
they did. I don't think they have.
Okay. All right. And you're getting all kinds of compliments here. And I think someone asked where you're located. But again, like you're in Cooper City, which is in
Hmm.
South Florida, but
Yeah.
you're also able to see people virtually. So
Yeah.
it's good.
Yeah.
And as far as, oh, yeah, someone mentioned we should do a live with Dr. Gelman success stories. We did that actually. So, we do have it on our website with Nisha, so who's one of our mutual patients who's about to deliver soon, actually. She's doing really well. So if you go to Florida Complete Wellness, you can actually see that on the homepage, which was really nice because we did a lot of these for National Infertility Awareness Week. So we have a few stories to share, but I mean, there's so many that we could talk about. And if any of you guys want to volunteer to be on our live, we can have you guys message us. You can message me or
Yeah,
IVFMD.
that'd be great. I love having you
Yeah,
guys.
we would love to, and we could actually invite you on and share your story with others because I really believe that it increases people's awareness and also helps. When you're kind of at your wit's end and your hope has just been dashed by, going from procedure to procedure or getting a negative pregnancy test month after month, it's really good to hear from someone who's been in your shoes, who's overcome so many obstacles and
Peace.
know that it's possible. So if you guys are watching who have been a patient of ours, you would like to share your story, you can please just message us or message me or IVFMD, and we'll be happy to get you on. We love doing that. It's so much fun to share stories like this. So, okay, so let's get back. I'm getting a little distracted tonight. What's going on here? We have what AMH is considered DOR. We have a question about that.
Depends on the age, but probably less than 1.06 or 1.05 ish. Certainly
Okay.
under one. Certainly under one might be. But in a 42-year-old, if your AMH is 1, that's not DOR, so to speak. Although
It's normal.
the patient has DOR, really, because the egg quality is not very good, maybe at that age too. 70% of those eggs won't be normal. But you wouldn't qualify. You wouldn't say she has DOR. She just has AMA, advanced maternal age. Even though the AMH might be high for her age, the egg quality would be an issue. So, AMH is one measurement of things. You got to look at chronological age in addition. So
Okay.
just again, meaning that the AMH can be really high, but if the patient's 42, 43, egg quality is really not going to be very, very good. So, there's a difference between having a great AMH and having DOR in a sense. When they refer to DOR, they're really referring to maybe a 35, 36-year-old with an AMH of, 0.8, 0.7, something like that.
Okay, very good. Yeah, and so depends on your age range and also your
Correct.
AMH, where you get that level drawn, because it can really vary according to the lab we've seen.
Well, yeah, the
So
lab
yeah.
too. I mean, that happens all the time still. I think Quest is getting a little better with their standards lately because they were notoriously inaccurate for a number of years, but I think they're getting better now.
Oh, it's good.
So Unilab, the lab we use, the endocrine lab, is still the best and has the standards that we trust.
Very cool.
So when we get an AMH from there, we know what the AMH really is.
Yeah, so don't let that number, preoccupy you too much. If you
Correct.
got it done at LabCorp or whoever, because it can definitely vary. We've had some patients get depressed about the number for months and months and months, and then they get it drawn again, and it's like, oh, it's normal. So,
Correct. It happens.
yeah.
And if you're on birth control pills for months and months and months, it could be lowered. We didn't
Okay.
think that was the case, but that is the case.
Okay, that's good to know, Jan. So, okay, and then also a canceled FET due to intrauterine fluid. What causes this? I'm worried it will reoccur.
Yeah, fluid in the cavity. I mean, the one thing you'd want to look for is, something in the tubes. Maybe is there abnormal tubal function, like a hydrosalpinx or something like that, that's communicating with the uterine cavity, causing
Hmm.
that fluid to build up, and that could, obviously impair the success of a frozen transfer. So that's the first place I'd be looking
Okay.
um, in that situation. Sometimes it's mucus, actually, but endometriosis might do it. But still, the most common thing that we would think about is tubal.
Hmm.
So
And
that,
then, is there
yeah.
treatment for that? Like, do you give any
Well,
medications or?
the tubes have to be looked at, and possibly if they're problematic, they should be addressed. Now, usually in that situation, they're either ligated before you do another transfer. Actually, you'd have to cancel that cycle probably because you don't want to transfer. And then you would want to re-prep the uterus after the tubes have been either ligated or removed, so that there's no fluid communication there with the inside of the uterine cavity.
Definitely, and that's just a frustrating thing for sure. When things get canceled, it's frustrating, but it will get better usually. So,
Yeah, well,
um,
you're better off canceling it than transferring an embryo and not being successful.
mhm. Yes, and we also have a question about what days should you do acupuncture while doing a Femara HCG shot cycle? So not IUI or IVF, but still it's a medicated cycle. I mean, I still think that it's good to do acupuncture twice a week when you're undergoing any kind of treatment that's also kind of, stimulating your ovaries in some way, because everything has to work harder a little bit. I mean, every month you ovulate one follicle, right? One little egg, but with these medications, sometimes it's more than one, and sometimes stress can affect the HPO axis where everything has to work. So that's why we try to encourage that, if possible, to do twice a week. And patients that are just trying naturally, they're like, okay, I'm just going to see if I can try to conceive for like 6 months or a year. Once a week is fine. I mean, I don't think that we have to, really kick up those treatments so much in that case. We are just basically working with the cycle and, doing nutritional things and helping with stress relief and that sort of thing. But anytime you're introducing, and in my experience, introducing medications, it's going to sometimes have side effects, sometimes not, but we want to actually make sure that we're doing all we can. So we do recommend that. Any input to, well, we've already talked about, I think, what you'd
No,
recommend as
I
far
think
as that,
that's
yeah.
that's the right thing. I mean,
Yeah.
twice a week. I think that would be perfect. Whether you're doing FMR or you're doing IVF, I would do it twice a week, even during that, second part of the cycle there. I think acupuncture is important too
Yeah, I think the
to
thing,
help
what
implantation.
days,
Hmm?
yeah, which days would be really, you don't have to schedule certain days, but we do like to see the patient around ovulation time as well. If they are trying to do a treatment around a specific day, that, could fall on perhaps like the day of ovulation or the day before, which is kind of nice because sometimes we pair that with a little bit of lymphatic massage, fertility massage. Had many patients get pregnant that way, which has been
Yeah,
very helpful. So,
yeah.
um, so as far as another question here we have is three failed IUIs, prepping ovaries with birth control for IVF, but appointment is August 27th. Is 3 months too long for birth control, with birth control?
Yeah, that's a long time. We should try to keep it, up to 21 days of
Hmm.
active pills, and maybe you need to take a break before you go back. Maybe you should take a week off and restart, so your ovaries don't get overly suppressed. Obviously, if you're young and you've got, real good ovarian reserve, you'll probably do okay. But if you're older, that might be, something that could cause a poor response to the stimulation drugs if you're oversuppressed. So I would try to talk to your coordinator about that, and maybe they're giving you breaks in between so that your ovaries can air out a little bit before you start, so that you're not oversuppressed by the time you come into your baseline scan and you don't stimulate well because your ovaries have just been, you know, suppressed by the birth control pill.
Yes. Yeah, so that does come up a lot though, as far as the question, like, is this going to be too long? Am I going to be oversuppressed? That sort of thing. So,
Yeah.
so maybe they just need to check in with their doctor or nurse just to make
Well, they
sure
should.
that's right.
The coordinators should give them, some leeway there in terms of what to do. If obviously they're getting, maybe they're getting on, putting on a pill a little bit too early. Maybe if they're starting their IVF the end of August, maybe they should try to get on birth control pills, in July or August itself. Maybe if you get a period early in the month, that might be enough time. So it
Um,
depends when your cycle is, but if you're already on the pills, I guess, um, then maybe try to schedule a little break in there so your ovaries aren't oversuppressed.
yeah, and the question came up also we have about FSH because that is one thing that people also worry about. What are some natural ways to lower FSH? And birth control lowers it, right? I mean, there are medications, I guess, that can do that, but it doesn't change your ovarian reserve, which is the main reason I think that people are getting that checked. Um, but, as far as that goes, do you have any suggestions about someone who is trying to lower their FSH?
Well,
And
I think that's when your FSH is high, it means that your ovaries are starting to maybe struggle a little bit, and you're not necessarily perimenopausal, but it may mean that the ovarian reserve is a little diminished and the FSH is starting to rise, um, and your AMH is probably lower than you'd like it to be. Um, I think those situations would be I would consider estrogen priming, which I use a lot of, where we actually use estrogens in the luteal phase to
mhm.
lower that next follicular phase rise in FSH for the next cycle. And we use a lot of it in the practice. I think the other doctors are doing a lot of it too.
Hmm.
It's called LEP, luteal estrogen priming. And there are also long protocols to do that too, but the shorter one is very easy. And it seems to really help rest the ovaries and regroup eggs or bring eggs up a little bit to the surface of the ovaries. It's not going to make your egg quality better than it is or genetically determined is, but it may bring more eggs up and allow us to recruit more eggs with fertility drugs, because if we don't have eggs at the surface, we're not getting them.
Yeah.
So you want to lower that FSH down, and then that's when you maybe want to do this for a couple of months before you start a recruitment cycle.
And we have seen some shifts with patients doing that with the diet, working
Yeah,
with
and
supplements
some
or,
people get pregnant doing that.
yeah, yeah. So
And
that
we
can
know
help.
estrogens seem to make the ovaries younger a little bit in terms of more active. That's the word,
Mhm.
more active.
Yeah.
Um, so that's be exactly what I would do with that person.
Yeah. So that's, and some people do get pregnant with high FSH as well. It doesn't mean
Yeah,
that.
it's not a, everybody thinks it's a death sentence. It's not. Yes, that's absolutely true. Some people do get pregnant with high FSHs. So we don't tell you that that's not going to happen, but we want to try to improve the situation and work around it and make the best of it.
Yes, for sure. As far as that, it could take a little longer, but it is worth
Yeah,
it's worth giving it a
it's worth
shot,
giving
right?
you a
Yeah.
couple of months along with
Hmm.
some DOR supplements and vitamins and things like that Martha will talk about. But those things maybe help in acupuncture. So it gives you time now to improve things and maybe make things a little better to give you a better recruitment for when you go into IVF. Because the more eggs you have, the better it's going to possibly be.
So we also have a question about I think Nabotian cysts because it says Nabothian cyst on the question here. I think it was either in the chat or I saw it submitted earlier. But um, so I guess what type you're asking about acupuncture, but I think anything on the cervix you have to be very careful. And I would think you guys are going to look also for polyps or anything like that, they could have an issue with fertility. It could be obstructing that. So do you work with those, or you see them commonly, or how do
And the
you work
both
with
the
that?
cysts, yeah, I mean, they're mucus retention cysts in the cervix. I mean, I really, we don't really, they really don't interfere with what we do too much.
Okay, so would you not really bother with treating them, or just kind of,
No, I don't.
okay, okay. Alrighty. Polyps, on the other hand, they can cause a problem, correct? I mean, it
Well,
depends on where they're located. In the
polyps in the
uterus, right?
uterus
Hmm.
are a different, different animal. That's something, we would address, specifically looking for. But
Um,
the both cysts are just mucus retention cysts.
okay, very good. And yeah, because I haven't really run across that so much with our patients, so I can't say if acupuncture can help or not. But that's something to
Well, it
research for
might.
sure.
I mean, person's asking about what heat in the abdomen. I mean, maybe
Hmm.
it'll help. I don't know of any
Yeah.
studies about that.
Okay, very good. You stumped us. Okay, very good. And let's see if we have another question here. I think we're done. We've done with the questions that were submitted earlier, and then we do have, let's see, a question about modern fertility results. So I guess there is a company out there where they can send you test kits, and you will submit, I guess I guess you do your blood work distally and then you mail it in. I'm pretty sure. I'm not sure how that works, but so they're asking about how do you feel about those results, like if they're accurate. I don't know what lab they're using. Do you know anything about
I
that?
don't. I've only seen a couple of people bring those in, and I think one fairly recently was fairly accurate. But one person, the other person that brought it in was clearly perimenopausal and had the symptoms to back it up, and had a
Okay.
very low AMH. So I believe the value. And the other one that had it done was a younger woman, but I think her AMH was actually fairly accurate. So
Yeah, so
depends where it went. I don't remember where they went or what tests or the tests
hmm,
they did, but that person I remember had an accurate test, and the other one was perimenopausal. So
okay.
that really didn't matter at that point.
Yeah, so I think that's so much more to it that you want to investigate besides just the blood work, but maybe it's a good starting point. But I definitely would recommend getting a thorough workup if it's been, months and months and months, and you don't want to waste too much time either,
Yeah,
right?
well, I always say this, every time if you're doing any kind of fertility workup, it's always good to get an ultrasound to see what
Hmm.
your antral follicle count is,
Yeah,
with somebody that knows what that means and all that, to correlate that with all your lab work so that everything makes sense.
yeah, for sure.
And,
That's
and that's
important.
sort of a double check on whether your AMH is accurate and all that. So you don't get misled.
Yes. Well, oh, I didn't realize we have gone over our time
Oh my
here.
gosh.
We're having so much fun, and there's more questions that keep coming in. Well, I guess we have time for one more question, so we'll get to the day 5 embryo better than day 6 or day 7, as far as I guess the transfers.
Well,
Uh,
I think we would choose day 5 embryos over day 6 or day 7. I mean, obviously they're a little slower developing. Not that they haven't made pregnancies, but certainly day 5 embryo is what we would opt for. If you have normal day 5 embryos, that's where we would try to implant first, based on the morphology, et cetera, et cetera. Um, yeah.
Very good. Awesome. Okay. Well, thank you so much. This has
Okay.
been extremely helpful. Thank you guys for all of your questions. And you can tune in, I believe, tomorrow. I might be mistaken, but I think it's tomorrow with Marta. And on IVFMD, you can follow Dr. Gelman at Broward Fertility Expert, right? Is
Yep.
that and then we're at FL Complete Wellness. So yeah, please follow us and also message us if you have any questions. You can also find us at Florida Complete Wellness and also at ivfmd.com. Thank you
Yeah. If any
guys
of you,
for.
and again, if any of you want to reach out and do a virtual consult, be happy to do it.
Okay, Shirley says the live is 12 p.m. with Marta tomorrow. So I want to tune in also for my office, and
Yeah,
I'm
that
going to
should be
ask
good.
Marta some
I
questions.
wish I could listen
So
to that.
yeah, yeah. So thank you guys so much, and have a great rest of your week, and we'll see you soon. Take
Thanks,
care. And thank you,
guys.
Dr. Gelman.
Good night. Good
Bye-bye.
night.